the last 7 years what's called de-escalation. That is realizing the patient's, what is the patient's situation? They have such low status. They don't have lots of family support. They can't really complain because they are insane, so they cannot write a complaint. So they're in so many ways powerless in different situations. So, but also I talk always when I say to the young doctors, you should know that the patient knows the power structure. Some people try to look big and strong to the patient, and I always try to look small because the patients know that if you push a button, within 2 minutes they are in restraints with injection in the bottom or whatever you say. So they know the power structure. So always try to make yourself smaller and so on. When the patient are admitted, we try to make a plan, like say, okay, if you get irritable, what should we do? Do you want to be alone? Do you want us to talk to you? Whatever. And so then there's a review. So you say, how well has this worked? Well, I must admit that we are trying our best. We try to do this, so we try to prevent people getting in the belt, get fixated. But the problem is sometimes we start giving them more medicine instead, and that is the problem. Next one. That was it.
Can we clap for the presentation? So now we will have opportunity to ask questions, to give comments, and if possible, to give some informations connected to the same topic. You have the floor. If you want to intervene, you do just like that, and I will give you the floor. Yeah.
What is your reaction to this? Is it like, well done, but you have all these resources, we have no ways of doing this? Wouldn't that be your first response?
Yeah.
Can you use it in some way?
We have here a problem of we don't have forensic psychiatry, and this problem was delayed because of the fact that there didn't exist a law. Because in the country where forensic psychiatric hospital exists, there is a series of law.
A law. That's a law.
Legislation
Yeah.
that have to be there
Yeah.
before to start. And there is a permanent communication between the courts and the hospital.
Yeah.
And also the hospital is somehow closed. It's like a prison.
Mm-hmm.
It's somehow closed. The police at the entry point. And when you enter, I am describing because I'm reminding when I went to Germany. It was like that. When you enter there, you see those patients. They have activities like therapeutic activities and other activities. They learn. They are occupied. They are occupied, but there is also a part of the hospital in which those who are very, very dangerous are put it. They cannot go from there. So, according to that law, before to put in a psychiatric hospital, forensic psychiatric hospital, a patient or someone who have committed a crime, you have to have the permission of from the court. they give the permission, and you do the report of all the symptoms, diagnosis of the patient, and you send them to the court, and the court accept that you can hospitalize him. Then you continue to treat him.
Okay,
there.
so you have the possibility to say they are not guilty because they are mentally ill.
Yes, yeah, because they've made the crime in a situation called the master situation without knowing what they were doing. Yeah. Now, when after like 3 months, 6 months, when there is a kind of amelioration, and they want to release the patient, they have again to ask the permission of the court.
Okay.
And even irregularly, the evolution of the patients after 1 month, 2 months, have to be sent to the court. So they have this good organization, and there are some agent of security, police, who are there, who control everything, prevent any danger. This, when I visited, I found it very interesting to do it here also, because we got a lot of cases. I don't know the number available. I think more than 40 crimes, person killed, others, and who was being hospitalized. Now there is a problem. Sometimes they are hospitalized in our hospital. When in our hospital we don't have a forensic unit, and this creates a problem. Create a problem because those patients can kill a nurse or a doctor.
So what do you do? Simply medicate?
Yeah, someone have a risk. Someone was, even a patient was being killed in a case because they obliged, the court obliged the hospital to hospitalize the patient. But the patient was very dangerous, even to inject treatment to him. It was not easy. And one day, he killed a neighbor, another patient. All those risks are there because we don't have forensic unit, we don't have, we don't have psychiatric, forensic psychiatric hospital.
With more security.
Yeah. So that's why your visit is very essential, because you can do advocacy not only in our hospital but at the Ministry of Health, at the organization like RBC and so on. So this project of creating a psychiatric hospital, forensic psychiatric hospital, can be done very, very quickly. But now, another aspect of forensic psychiatry that we are doing is the fact that when there are crimes and other things committed in a state of mental disorder or psychosis situation, we do a report. Normally, the court asks the psychiatrist, the hospital, and the hospital requests the psychiatrist to do a report and to specify if really the patient was in a state of mental disorder when he committed the crimes, or if he was not in the state of mental disorder. And at that level, sometimes we have some difficulties because a patient can kill someone in a time when we were treating him and we have seen that he was in recovery and he went to home, we continued the treatment, and we listen that he killed someone. They bring him to us and they ask if he was in a state of mental disorder. And sometimes it's combined with some interest of land, to take a land, and so on. And this thing that we're talking about of malingering intervene. You can ask yourself, this man was stable. We know that he's a mental patient, but he was stable, and we don't have the report in this period when he killed the person. We were not there. That's why we ask often to those judiciary police to give us a report of the situation that in which he was when he killed. If he was sick or if he was not sick, they cannot give us. They don't give us. But I know that in Switzerland they give all the information to the experts before to do this report. This is the first challenge that we meet often, because you start to ask yourself, is it someone who is trying to show that he was sick to get his interest, or he was already cured? The other one is, and this is a question to you, it's my question, is the fact that in Rwanda, the consumption of cannabis is punished by the law. You can be put in prison if you are dealing with cannabis, taking cannabis, you have cannabis with you, they can put you in prison. In one side. On the other side, you can take this cannabis and develop mental disorder. Now, the court will ask the expert to say if he was conscient or not, if you have to be put in prison or to be hospitalized and treated. When we know that already the taking of cannabis is a transgression of the law, and the taking of the cannabis is often connected to a personality which is connected to psychopathic personality. And as you know, in psychopathic personality, we don't consider that he was not aware of things. We cannot consider it. So it can be punishable, considered from a point of view. But you can considering to all those challenges and your experiences there, you can react to this question that I'm presenting to you. Yeah.
The question being, what's the question?
The question is, this man have to be put in prison or in the hospital?
That's, the way we see it, that's actually something that's if you take drugs in general, cannabis too, you can get an acute psychosis. You can also, research also show that it's been taking them forever to find out that it seems to also promote schizophrenia. But at least you can be psychotic in a very short, on a very short basis. We get them in all the time, young guys been smoking public cannabis, and we are like, is it going to be schizophrenic or is it going to be in 2 weeks? Right? And what you're saying is interesting there because in Denmark, there's actually a generational gap among psychiatrists because the older psychiatrists would say, well, he was psychotic at the time of his crime, therefore he shouldn't be punished. And then the younger one would say, well, but he actually went and bought those drugs, so therefore he is guilty, right? Even though he was psychotic at the moment. And that's one of the key problems there. And you can easily defend say that someone who knowingly bought a drug that makes them mentally, that they knew, I don't know how much they knew, but at least they knowingly did a criminal offense. Yes, that's true. So therefore you might say they might get a punishment for that.
So now those who are dangerous to our patients, can we put them in prison even if they have a mental disorder and treat them there because of their dangerosity?
You can. It depends on the resources, right? And also, I think it's a little bit also a question of humanity, right? That if someone is schizophrenia, it's not your own fault that you get schizophrenia and suddenly you're in prison. But I mean, if it's a dangerous situation, you have to do what you have to do. Okay. All right. Thank you very much. Thank you for listening.
Other comments? I see Rose smiling. Do you want to intervene? Hatuishi zinc technique. Yeah, he's giving a suggestion that we can because those technique was very interesting, especially the 10 techniques. He said that it can be good if you can
Yes.
have another time
Try to explain that.
teach us all the techniques and do practice.
Yeah. You can do that. Interesting, yes.
Very cool. So, niba nakindi kibazo mufite, there is no
Thank you for listening.
Thank you for your kind attention and for your presence. And thank you, Professor, for this excellent presentation. I hope that we will keep in touch and continue to have exchanges, just to have the opportunity to develop forensic psychiatry also in our country. Thank you very much. Have a good afternoon, everyone.